Hello, everybody, and welcome. This is Nurse Eunice with Florida Training Academy. In today's video, we have a wonderful guest. We have Shane Grindle, the founder of Medpreneur, who's going to be discussing men's health matters. As we do in all of our videos, we're going to give you about 5 seconds to receive your notifications, and we'll be back shortly. All right, so welcome, Shane. I want to give you, first of all, I want to thank you for being here. You know how much I enjoy talking to you. You are one of my favorite nurse buddies. And what I
Um,
want to do first is just read your bio. So, you are the founder of Medpreneur, a dedicated advocate for men's health. You're also a family nurse practitioner. So, and we have here that you bring a wealth of clinical experience and a commitment to guiding healthcare professionals toward innovative career paths. Can you tell us more about your platform, Medpreneur?
yes, I mean you took the words out of my mouth. Thank you. Right. So I really love entrepreneurship and I love medicine, and I just wanted to find a way to blend them both together and to also help nurses like you and me. And that's just been really a gift, and I've been really blessed and fortunate. So I'm excited to be here. Thanks for having me. I love our conversations. Always,
Yes.
always.
And so when I realized last week that some of my audience, they could not answer questions about prostate health, I realized that I had been doing them a disservice, that I had not talked about men's health. And I'm like, who better to talk about men's health than, of course, the
Hey.
man himself?
Thank you. I'm just happy to be here. I'm so passionate about men's health, and men are we've got health disparities that I'm going to get into here soon, right? And it has to do with a lot of different things, right? Men, sometimes we don't do what we're told, do we? We don't go seek help. Women are living longer than men, for those reasons, right? And so I just want to let everyone know that it's okay to ask for help. Reach out. We are here to help you. And it's just really important.
Very important. So, what my role is going to be, everybody, and hello to our viewers. I see you saying hello in the
Hello.
chats. Is that I am going to be filtering the questions for Shane, and so I'm going to let Shane take over. And when I do interject, it's going to be because one of our viewers has a question. So, Shane,
Love
you
it.
can take over now.
Wonderful. Well, thank you guys for having me. And, this is a very important topic that's near and dear to my heart, and it's men's health. And it's not just because I'm a man himself, but I think it's important that we take care of both genders, and everyone is very unique. Men are unique, women are unique, and there's different health issues that impact both genders. And today I'm going to talk about men's health. I'm going to talk about how men are unique and what are the concerns that men face often. And it's for different reasons, and I will get into that. Okay. This first fact is what I said before, is that men are less likely to seek medical care than women. Yet they have unique health challenges that require attention, right? And that's what I want to get in today, and to share those with you guys, and answer your questions. It's very important. As far as men's health, we need to be able to look at things early, get those preventative care in men, right? Those dreaded colonoscopies, but they're so important. They're so important, right? Because we seek less help for mental health issues, right? And it's for many different reasons. It's societal issues like that. I call it toxic masculinity, and that's the idea of the man having to be the man, right? That's not the case always anymore, right? So that's a great shift that I really appreciate, is that men can also be vulnerable and get help too, though, right? And that's because we have a higher risk of getting heart disease, heart attacks, stroke, all these things as compared to women. And we even have our own reproductive diseases too, not just women, right? Uh, there is cervical cancers. There are different things like that for women, but for men, we've got prostate cancer. We've got all those different things, BPH, hormone issues. So I want to get into that and share that as well. And so we're going to get the ball rolling with BPH and prostate health. So what this is called is benign prostate hypertrophy. So let me get into these big fancy words, right? Benign means not cancer. prostatic is just the male organ called the prostate. Hyperplasia is getting bigger. So, in big words, brought it down together, it is the prostate is getting bigger, not due to cancer. So, that's one thing I wanted to share, that this is not cancer, but this is the prostate getting bigger. Okay. And then I want to get into what does it look like? Should I be concerned? And then who is affected, right? So I want to kind of go back to some other thoughts and statistics before we really get into that, is that men have a lower life expectancy. And for, let's just look at the facts here. Excuse me. Is that at age 65, for every 100 women, there are only 77 men alive. And then we're going over to age 85, right? And then it's scary because 2.6 to 1, that's how many women are there for men. So that's one thing that I want to kind of really get into before I get into the prostates and health, because there's a lot of things that men should be doing. So going back to the prostate here, is that men over 50, they are affected, right? Because it's just natural part of men sort of getting older. Things start to break down. And in men, what happens is that our prostate gets bigger by just age related things, right? And going into those statistics is that men, 90% of men over 80 have BPH at some point, right? And then men that are 60 to 69, 70% have this. So it's a prevalent disease that no one's really talking about, right? And so what I want to do is talk about those risk factors, right? So as you get over the age 40, that's what happens, is that that's a risk factor that you can't modify, right? Same thing with your family history. You can't modify it. You can't change it. You can't move it, right? But what you can do is obesity, is lose weight, get some exercise, get your activity, get things rolling, and to control those chronic diseases, right? And that could be heart disease, diabetes, vessel diseases, right? Those are very important things that we can control and fix and modify, right? And here are some important facts that I want to kind of bring your attention to, is that it's not cancer, like I talked about before, and you don't have an increased risk for cancer here, right? And this can be a normal part of aging throughout a man's life, if the prostate does get bigger. And also, the bigger prostate doesn't mean that you're going to have a severe issue with your prostate, which is sort of fascinating, honestly, to me. And but if it's left untreated with these things as well, you can get bladder stones, you can get UTIs in men, kidney damage, bladder damage, right? Because now we are holding in that urine and it's not going anywhere, and it sits there, and that's what causes those UTIs and those infections and those stones, right? Symptoms, right? Men can have these early, and there's different severity of these different ones, and that is difficulty with urination, starting that stream, frequent urination, especially at night. That's one of the things I look at, and I ask questions. You know, when you walk into my office, every question that I ask has a reason, had the methodology. I'm kind of like a detective. I'm asking all these questions and seeing, is it BPH? Is it cancer? Is it kidney stones? So these are some things that I ask, right? And it's urgency to urinate, right? It's like you can't quite get it out, and you know you've got to pee, but it's not coming, right? And your stream can be interrupted or weak, or I call it a bifurcation, where the stream comes out in a pair. So that's a thing that I also look at as well there. And moving over to prostate health as well, is that prostate cancer is a severe form of this, right? But the good news is 97% survival rate if we catch it early. But the problem here is that 299,000 new cases are going to happen in just 2024 alone, right? So let's look at some statistics. I really love numbers, because then again, that will tell us how prevalent, who's affected, and that is 1 in 8 men will be diagnosed with prostate cancer in their lifetime. That's a pretty staggering number, right? So I also want to move over into STDs or STIs. I like the term STI better because it is a infection, and a disease is more of a general term, if that makes sense to you guys, right? So common STIs, you've got herpes, you've got chlamydia, gonorrhea, syphilis, HPV. Yes, men can get HPV too. The problem there is that we can pass it on to our partners, right? And the only a condom can protect you against all. I wouldn't say all. I would say like a majority, right? So there are certain ones where there's open ulcerations that sometimes you can get that, but that's not common, right? So we're going to talk about symptoms. What does it look like? How do men present versus how do women present, right? It's just a whole different ball game, but still it's the same problem and the same severity in both genders, right? Over a million, right? A million different sort of people that are infected every year, right? And that's across the world. So it's a prevalent thing for both genders. That's 1 million of both genders, not just men. Okay. So as I said before, here are some facts. I like to give you some facts so that there's a lot of myths out there, and I want to help you understand that there are some things that kind of run around TikTok or whoever that just isn't true, right? So one is if you use condoms correctly, that's what I mean by doing it correctly and consistently, it is the most effective method of STI prevention, other than abstinence, but we all know that's not necessarily like a reasonable thing to do. HPV, though, is one of the few STIs that are preventable with a vaccine for men and women, right? It doesn't cause the cancers like it does in women to us, but we can still get cancers ourselves, like throat cancers and penile cancers. So think about that, right? And then there are some things here that can lead to infertility, organ damage, kidney damage, bladder damage, just like the prostate, right? So I wanted to put some similarities and kind of overlap there because it's a sexual organ disease, and so that's kind of what I wanted to kind of show the overlap. Prevention, like I said before, the only 100% way is abstinence of these STIs, but condoms are the next best thing, right? And then for both men and women, but today, especially for men, we need to get screened, we need to get checked, we need to have a good rapport with your primary care provider or your OBGYN and have these done because we're going to talk about why that's important, but it's so important for men, right? It's because diseases like chlamydia have no symptoms but can be transmitted to your partner. And that's a problem, right? Is you can walk around, have chlamydia, and have no problems whatsoever. That's scary to me, right? And you can still transmit it even if you don't feel like you have anything. That's the tough part here. Chlamydia, I want to give it some special attention because in women and men, it can lead to infertility problems. And I know I'm talking about PID in women or pelvic inflammatory disorder that can lead to infertility, especially if your goal is to have children. You need to be at your optimal health and your optimal well-being before you can conceive, right? And with this being a problem for both genders, right? And that's the thing is that there's no symptoms, which can lead to infertility in the man that he doesn't even know that he's got it, which is a scary thing. Symptoms. So these are symptoms of most, I would say, STIs or STDs is pain with intercourse. These can happen especially in women. Infertility. I know when I've done some workups with men and women who can't conceive, this is one of the tests that I always run is a full STD panel, HIV, gonorrhea, also chlamydia, all these things, because you can walk around and not know what's going on. So this is so important. And so you will have penile discharge, all these different things as well. There's often no symptoms in men. That is the scary part here, right? So I want to segue over into mental health. This is a thing that's very near and dear to my heart. I was in the military. As you know, we all have these mental health concerns, especially in men. And, we don't want to talk to anyone. We don't want to share that. It'll make us look weak, but that's not the case. Is that we are here to help, not judge, right? That is my goal, is to help you and not judge you, because we've all been there at some point in our lives, right? We've all been sad, we've all been anxious, but then again, I don't want you to get to a point where it's chronic. You're not able to do things in life that you deserve and that brings you joy and pleasure. And so I want to talk about that just for a little bit. I mean, this is very important to me, because mental health is sort of like a umbrella term, and we need to look at it as such, right? It isn't just about how you feel. And what's the sad part is no one sees mental health, right? Because you look normal. It's a great term of saying you can't judge a book by its cover. Be nice, because you don't know what that person's going through, right? You just never know. So that's one thing that I want you to do for men, women, and whoever, is just to understand. This is a powerful quote, right? The greatest weapon against stress is our ability to choose one thought over another. Choose the thought that brings you happiness, joy, and peace, not the one that brings you anxiety, stress, and sadness. It's hard. It takes time. It takes practice. I struggle myself too. Certain days are worse than others. Sometimes you may lose your mother, you may lose your father, you may lose a loved one. And I always tell my patients is like, do the best you can, and that best may not be the same as it was yesterday or as it is today. So give yourself some grace there. All right. Symptoms here are just, it's, you don't notice it, right? That's the crazy thing about mental health, is that it's, you lose sleep, you lose fatigue, you lose interest in your hobbies or doing things, and then you start to isolate. You just don't want to be bothered. You're just in a bad mood, and that's for both genders, but especially so in men. And I'm going to tell you why that's important here soon, but that's what it is, right? And this is it. Men are less likely to seek help. You see how things are going full circle back to where it was before, is we don't seek help, right? There's a different reasons, right? And that's what I said before, is the toxic masculinity. Man is supposed to be strong, not weak. We're supposed to, take charge and lead and not be vulnerable. But that shouldn't be further from the truth, is that we need to be able to ask for help. And that's okay. And if you see men that are having these symptoms here, I'm going to go back here again. The loss of sleep, fatigue, loss of hobbies, isolation, right? But you really have to look for these things in people, and you might not even notice it and put two and two together. But just know that you came to this video and now you know a little bit more about it, and that's okay. Do your best. And look at number 3 and 4 here. I just want to kind of pour you here, is men have a higher chance of successful suicide, right? The reason why here is men choose more lethal ways of killing themselves or doing suicide, either with hanging or firearms or those types of things. That's why I'm very in tune to the men. Is like, it's always a tough conversation to ask, have you had any thoughts of hurting yourself or others? And sometimes they don't want to be honest. And you just got to do the best you can. Just be that good friend, that good support that'll literally save a life, right? And as I said before, at 4 is that if it's untreated, it can lead to suicide, right? And it can also lead to chronic diseases, right? We're going to talk about how stress can affect many things in the body, like your hormones, like your energy, like your weight, all these different things, right? So I just want you to understand that it's not just all in your head. It's not. It's really not. It's a real thing. And if anyone tells you differently, they're wrong, okay? Because it can cause chronic health disease. It can cause unemployment because now you're taking more sick days because you're not feeling well. You're tired. You don't want to get out of bed. It's very dramatic. It's very dramatic, and it can also lead to domestic abuse things, right? You can be stressed and angry, and you take that anger out on people that you care about, and you don't often intend on it. It's more of a reflex response, but that's never an excuse, but it is a reality, right? So that's what I wanted to kind of dive in there and share, right? Treatment here. Let me move over here. It's going to be medications, therapy. Thank you so much. Lifestyle modifications, treatment of underlying diseases. Now, this is what gets my medical mind going. Is I ask myself, why are they depressed? Why are they anxious? Why are they feeling this way? And it can often be from thyroid disorders. It can be from low testosterone in men, which I want to also get into here in just a little bit, right? And anemia, which can also affect men and women as well. More so women though, but we'll talk about that. So that's why, as part of your workup when you come into the office, I'm looking at everything from your iron, your folate, to all those different things as well, your thyroid and everything. So there's a lot of factors, right? So this can be a symptom of a chronic disease. So that's what I also wanted to share as well. Okay. And now that we're talking about, the mental health side of things and how it can affect hormones, this is a natural segue into how hormones can be a culprit and can be affected, which is fascinating to me. And that hormones aren't just a female problem, it's a male problem too. And we're going to talk about that. I also wanted to pull back here just a little bit and talk about the medications here. Um, that's a good segue as well, because certain mental health medications can cause sexual dysfunction, right? That's one of the side effects. And that's why certain men don't want to take these medications, because it causes that problem, right? So, like your SSRIs, like your Wellbutrins of the world, or your Lexapros, right? So, that can be a problem as well. But the one thing that we can all modify and change and do is what I call lifestyle modifications, right? And that goes for all of these things that we just talked about. These are you controlling the controllables, right? You can't change genetics, you can't change your age, you can't change those things, but you can change what you're actively doing, right? And that's get active, eat better, do more. I'm guilty as well. I always say, do the best you can with what you can. I don't expect you guys to be perfect. Yes, Miriam, I wanted to pause and say thank you. It is so important to be kind and be nice to each other. That's one thing that I've gotten so much better at, because it's so much easier to just be mean and take it out and just be angry. But really, long term, it helps nobody. It doesn't help you. It don't help patients. It doesn't help your loved ones. And so that's such a good point, and you're very welcome. So happy that really kind of resonated with you. So thank you for that statement. That's a great one. So now we can move over to hormones. Sorry, that was my little soapbox, but I just think it's really, really important. So important medical facts here as far as hormones and testosterone and all these things as far as erectile dysfunction, right? Is we talked about how lifestyle changes like exercise can prevent ED and the loss of testosterone, right? Because now that heart is healthy, it's able to pump more blood. Those vessels are much more healthy, right? So now you get more blood flow to areas that are important, right? And that's important as well. Let's pull back, because men start to lose testosterone in their 40s. And that's about 1% to 2% per year, depending. And that can be caused by, that can lead to erectile dysfunction, and which can be an early sign of a more serious disease. So that's why I always have concerns of people that just prescribe medications and don't ask why. What's causing the erectile dysfunction? And that's where my theory and my treatment philosophy is a little bit different. So I always ask why. So if you look at this timeline, right, it starts to drop as a natural part of aging, starting in the 40s. As you know, as the hardest part of my job is to let everyone know we all have an expiration date. It's just my job to make it longer and better, right? And this is the natural part of aging, right? And like I said before, it's 1 to 2% per year. But the problem is, as you hit age 70, you can lose 30% of your total testosterone, right? So that's the hormone that makes you a man, right? So think about how much of a man you feel like in these decades as you start to progress. You start to get self-conscious in things, right? You start to have erectile dysfunction, which I'll talk about. And so I want to kind of pull back to the mental health thing, right? So now we're coming full circle here, right? Men are starting to lose their, I call it vigor, their vitality, right? And we all have needs, and these are sexual intimacy, which is normal. And that's why I tell patients all the time, it's like, it's fine, it's okay. And to have the intimacy, but we can help you with that as long as you qualify, right? And that's what I'll start to talk about too, though, as well. And as you look at the timeline, right, 40s, 50s, 60s, right, it just starts to drop, right? And so you'll see here that mental health is also a problem of men in their 60s as well, right? I mean, there's a I call it a correlation here, right? Is that mental health drops as testosterone drops. I mean, that would make sense to me. Testosterone. So, fun fact, women thinks that, it would make sense that you have more estrogen in your body than testosterone, right? Wrong. You actually have more testosterone in your body, right? The reason why is that it helps you do a lot of different processes in the body, right? It helps to create muscle. It helps with metabolism. It helps with bone health and growth. Why do you think men don't really have a lot of osteoporosis, right? Is that we have more testosterone in our bodies, right? So that's what testosterone does. And it also it also creates libido for both genders, both male and female. So when I'm looking at the hormone panels for both genders, men and women, I look at testosterone too. With females too, is that you need that, right? That can cause anemia as well. And it can cause issues with mental health if you don't have enough of it for both genders. So I just wanted to share that little fact there, is that you actually have more testosterone in your body than you might think it's females, right? Symptoms, right? So if you look at what testosterone does, right? So you can kind of leap to the next logic of, hey, what does a lower version of that looks like? Well, for both men and women, but we're going to talk about men, right? Low sex drive, fatigue, mood changes, low muscle, and weight gain, right? I can almost look at a male body and say, yep, he has low testosterone by just because how he looks, how his body is, right? So that's why this is a physical thing, right? I always say treat the patient, not the number, right? If they're having these symptoms with borderline levels and they benefit, why not, right? So that's kind of how it would look. And we talked about erectile dysfunction. I'm going to get into that too, though, as well. But that's another issue, right? And treatment, right? So we can replace your testosterone. We can treat your chronic disease, and we can prescribe you medications for erectile disorder, which is fantastic, right? So you don't have to deal with this. You can be treated for it and be taken care of as long as you qualify for all these treatments and things go well, right? And that's same thing with erectile dysfunction. The same thing goes is that these are called PDE5 inhibitors, like Viagra, Cialis, all these things as well. Um, as long as I'm treating your chronic conditions and everything is optimized and you're still having problems, okay, fine. But do not take this with nitroglycerin. Why? It causes a profound drop in blood pressure, so low that you can actually die, because then again, you don't get enough blood flow to organs, heart, and brain. So that's why you don't want to take nitroglycerin with Cialis and Viagra. I hope that makes sense. But another thing here is get medical help if you have an erection lasting longer than 4 hours. That's a condition called priapism, and you don't want that. And that's one thing, I can't look at you and say that's going to happen or not. So I just recommend that you keep an eye on that. Okay. Well, thank you guys for having me. Right. And I just wanted to wrap up things here and talk about just schedule regular checkups, know your family history, ask those questions. I know in certain cultures and families, no one wants to talk about, your history or what mom and grandma has, but I think it's an important conversation to have, because that will also help me as your clinician to say, all right, I need to screen more tightly for this, right? Exercise and diet, do the best you can with what you can, right? Maybe one day you drop off the bandwagon and that's okay. Just get back on it, do the best you can, and that's okay. Stress management for both genders, men and women, but men especially, right? We tend to internalize everything as well. But stress management, just do things that you enjoy. That's the gist here. And seek help when you need it, because it's here and we want to help you. And so that's kind of what my thoughts are about the whole men's health thing. I hope it was helpful. Love to answer any questions you guys might have, right?
Very insightful, Shane. So, one
Thank you.
question that someone put in the comments is, how often should men get screened for prostate cancer and at what age?
That is a great question, and that has changed so many times, right? Um, it's a case by case basis, right? Thanks for asking that. And so oftentimes it's such a slow growing cancer. We tend to do it in the mid 60s, like 65, 66, in that area, but it's as easy as just a blood test called a PSA. And that way I can check. So I would screen you sooner if your dad or granddad had the had prostate cancer. So it's a case by case basis. So unlike a colonoscopy, which we just dropped that down now to a 45. So case by case basis, if that makes sense.
It does. And thank you for sharing that. And then I do have, I should know this. I guess I forgot that women have more testosterone
They
than
sure do. Isn't that great? Isn't that fascinating?
educated today. Yes. And then we do have another question. I know that you're based out of Jacksonville, Florida.
Mhm.
Another question was regarding mental health resources for men. Are there any online resources that you recommend?
There are so many great things out there as well. If you ever have an emergency, there is a mental health um, line that you can dial. I can't remember. I know it's changed. 611 It's one of those, but I would definitely use that as a resource. There is a lot of online apps and things like Headspace. Those are great things that you can do, and it's free, to where it would teach you how to cope and how it will help you to deal with those stressful times, those times of loss. And if all else fails, call your clinician. Try to get like a therapist on board. Um, I, it even I think we should all have a therapist. I can't tell you how many times I have walked out of therapy with just great tools that not only do I use it for myself, but I use it for my patients too. It's just such a great thing, because we are never taught growing up how to deal with those types of things. My mom never taught me how to deal with stress. You know, college never taught me to deal with stress. So I think we should do it, and we should do it well and do things that you enjoy. So there are so many great resources out there, including me. I'm very happy to be a resource as well.
Well, I'll go ahead and I'll add some of those resources to the chat. I
Please,
don't see
thank
any
you.
questions right now. So are you ready to begin the practice test so they can test their knowledge?
Yes, absolutely. I am excited. See what everyone thinks.
And do you want me to add them or do you already have them added?
As far as the test, yes.
Yes.
I have it right here. Yes, ma'am. All right. Sorry, I
No
don't.
problem.
Yes, can you add them, please? I didn't add them. I do apologize.
No problem. Just give me a few moments. If you want to discuss something else while I'm adding those slides, go right ahead and do so.
Absolutely. Thank you. Yes, yes. I'd just like to take this time just to, thank you guys for joining us and asking all these great questions, which, really tells me you guys paid attention, and I really appreciate that.
All right, so here we go, everybody. And again, Shane is our honored guest, one of my nurse buddies. I appreciate him so much. And we're going to get to that test next. But if you want to, okay, I need to backtrack. You all, Shane only has one YouTube subscriber. And guess who that subscriber is?
You, because you're the best. Yeah. Yeah. I think you've motivated me to just move deeper into YouTube. And so, this is my opportunity. So thank you.
You're very welcome. So
Yes.
one of the first things I'm going to do is I'm going to actually add your YouTube handle. So it's youtube.com/medpreneur. But on the next screen, you'll see it on the slides too. And if you want more information, if you want to go to Shane's practice, if you want business consulting, shanegrindle.com is the website. And let's get started. So question number one, team. What is one of the most common symptoms of an enlarged prostate, BPH? Is it A, high blood pressure, B, difficulty urinating, C, chest pain, or D, weight loss? And we'll give you about 3 seconds to start putting your answers in the chat. All right, revealing the answer in 3, 2, and 1. Shane, would you discuss?
Yes, absolutely. Difficulty urinating, right? Think about when the prostate gets bigger, it gets in the way and it blocks things. So now you're going to have a weak urine stream and you need to urinate more often. So that's a perfect answer.
Perfect. So great job. I see Marjorie and Miriam's. Yes, good answers, ladies. All right. So question number 2. Which group of men is at a higher risk for developing prostate cancer? Is it A, men over the age of 50, B, men under 30, C, men who do not exercise, or D, men with low testosterone levels? And I'm not sure if that was discussed. You gave so much valuable information, but I know that our team, they are some smart cookies. So we'll see how well they do with this question.
I know they're going to crush it.
They're going to crush it. All right. So looks like we have a B. We have some A's. We have a lot of A's. So reveal the answer in 3, 2, and how do you feel about that?
That's great. I think I briefly touched on it, but you guys did a good job of looking at it, because think about it, as you age more, then your prostate gets bigger with age. So maybe it's a little bit of an inference thing, but yes, men over age 50 actually do have more prostate issues. So great job there. I think they may have thought, with B, which was men under 30, they may have thought like who's got the least amount. So and that would be men under 30 who don't really have an issue. Prostate.
Understood. And then
That's right.
sometimes there could be a delay depending on what platform they're looking from. So it
Yep.
could have been the answer from the previous question that was just filtering through. All right.
Yep.
So great job, team. We are some
Great job.
lifesavers. So question number 3, which of the following is a screening test for prostate cancer? And I heard Shane say this.
I
So is it
did.
colonoscopy? Is it B, PSA or prostate specific antigen test? Is it C, ECG, an electrocardiogram, or is it D, mammogram? And I know we're going to get 100% on this one. So
Of
we're
course they are.
in 3, 2, and great job,
Um,
everybody.
Yes, hey, great job. Everyone got that one. That is great. Yeah. So it's a simple blood test, like I just talked about before, which we can check and see how things are going. And we don't do those. We call them DREs, to where we used to use our finger and things back in the day, but we don't do that much anymore. So great news, fellas. Great news. Right?
Again, I did not know that. So now I can tell people to not be afraid to go to the doctor to have their prostate checked.
Yes. It's just blood test now, so you can all relax. All relax
right.
now.
And question number 4, what lifestyle factor can reduce the risk of developing prostate cancer? Is it A, smoking, B, eating a high sugar, eating, it should be probably a diet that's high in sugar, C, sedentary lifestyle, or D, eating a diet rich in lycopene, which is found in tomatoes. So which can reduce the risk of developing prostate cancer? And we didn't talk about diet and nutrition, but while they're answering their questions, so Shane, one of the viewers wanted a practice test on foods that kill. So probably next week, we're going to be doing a video on foods
That's
that
a
kill.
great one. That's a good one.
I love our viewers. So everybody,
That's such a good one.
filling the correct response in 3, 2, and ding, ding, ding.
Diet rich in lycopene, right? And what's interesting about lycopene, ketchup has the most lycopene out of any tomato-based things. So ketchup.
Or just eat a tomato, right?
Yeah, that's fine. I mean, I would say go do tomatoes, but if you want to pick a condiment that can help you, I would say go with ketchup.
All right. So question number 5, which symptom is not commonly associated with depression in men? Is it A, feelings of hopelessness, B, unexplained fatigue, C, excessive hair growth, or D, irritability? And I know everyone's going to get this one right too. What is not commonly associated with depression? All right. So based on that response, I hope that you all chose
C, excessive hair growth, right?
And Thea cheated.
That's okay. That's okay.
I see the correct response in Thea. So yes, depression in men often manifests as fatigue, irritability, and feelings of hopelessness. And as Miriam said, be kind. You just never know what people are going through.
Yeah, that's such a good point. And let's go take it a step further here, right? Excessive hair growth would mean you've got too much testosterone, right? And doesn't low testosterone cause sadness and depression? So
I like that.
Right?
I like how you put that together. See, now we're ready for those NCLEX questions.
Oh, for sure. Yeah.
All right. So question number 16, which mental health issue is more likely to go undiagnosed in men due to societal stigma? Is it A, anxiety, B, schizophrenia, C, depression, or D, bipolar disorder? And this one's hard for me because I'm like,
tricky question, but I like it. This is gonna make you guys think. You're gonna have to dig deep here.
All right, we're going to give you 5 seconds for this one.
That's fair.
All right, looking for some responses. Remember, there's no right or wrong. We're all learning together. So we'll reveal the correct response in 3, 2, and all
depression.
Right.
Yes. I know it's a tough one, guys, but remember I talked a little bit about the toxic masculinity, right? Men are supposed to be happy all the time. They're supposed to be in charge, and you can't be sad or depressed, right? So that's the stigma attached to that.
Yeah, so depression often goes undiagnosed in men because societal stigma around discussing emotions and seeking help.
Yeah.
So, question number 7: what is a non medical method to manage stress and improve mental well being? Is it A, avoiding exercise, B, regular physical activity, C, increasing sugar intake, or D, watching more TV? And I know they're going to get this one. So on the easier ones, you can
Absolutely.
only give 3 seconds. So three, two, and answer should be coming through now. If you chose,
Physical activity. Yes, wonderful, right? It was tricky, right? I can see where you're like, watch more TV, which is okay, but I want you guys to get the most bang for your buck, right? Activity and exercise will also be a way for you to get off stress and to help the heart, right? So you get more bang for your buck here.
all
That's all.
right. Question number 8: which of the following can cause low testosterone levels in men? Is it A,
Mm.
aging, B, eating a high protein diet, C, drinking more water, or D, regular exercise? And I love that graph that you drew,
Yeah, thank you.
that you showed that diagram. So I think it went all the way back to like the fishbone. But
You did. Yeah, yeah, yeah.
all right, so team, if you chose,
Aging, right? Aging is that as you go throughout your life, you start to lose hormones and you start to lose all those things. So yeah.
all right, so testosterone levels naturally decline with age, starting in the 40s. And by the time you get to your 70s, your testosterone levels can drop as much as 30%, according to our expert, Shane.
Yes, it's true. I fact check
Life-
myself often. I often fact check myself, and this is the truth.
all right,
Yes.
so lifestyle factors can also contribute, but aging is the primary cause. All right, question number 9: which symptom might indicate low testosterone levels in men? Is it increased muscle mass, higher energy levels, improved mood, or low sex drive? And
Mm.
Shane, for lack of a better word or term, I don't know if I should say that, but you really drilled in this point.
Yes, it's
And so
important. I
let's
just see it so much, like in my practice, and so that's why I wanted to like hit it home. Is like we need to understand, you know.
And I see some of I call them my babies. I know we're not supposed to use terms of endearment in healthcare, but these are our faithful few. And I see those answers coming
Yes,
through. So, team,
I
if you
do.
chose,
Low sex drive. Good job.
so
Everyone
low,
did fantastic. Low
I
sex drive because it's responsible for your increased muscle mass, and it's also helps you with your libido. Even in women, remember women too. So it causes low sex drive with a low. So great
yeah,
job,
I joke with people. They're like, well, how do you do all this? And I say, I have testicular fortitude. Now,
guys. So in this case, you might be
now I
right.
probably just need to say, oh, it's due to my, testosterone levels, but
Yeah.
it definitely you can tell some differences in the hormones as you age. And I know as a male, but definitely as women, we can sense the different
It
changes. So
is.
question 10: what is a common treatment for low testosterone? Is it A, antidepressants, B, testosterone replacement therapy or TRT, C, antihistamines, or D, blood transfusion? And now, even though Shane may not have talked about this, just pull it forth. If something's low, how would we treat
Mhm.
it?
Process of elimination, as I teach my students, right?
Yes. And so we're
Process of
revealing
elimination.
the answer in 5 seconds. So 4, 3, 2, and I see all the correct responses. So Shane,
Boom.
take it away.
Yes. So testosterone replacement therapy is common for men with low testosterone levels. And I have changed lives and I've saved marriages. I promise. It helps. It works. It's yeah.
Is it an injection or is it oral medication or both?
Yeah, it's actually more than that. You can do skin creams, you can do injections, you can do pellets, you can do orals, you can do it all. It just depends on what you want and what you qualify for. So there's a lot. There's a lot of options. Great
Very
job.
educational. All right,
Thank
so
you.
11, erectile dysfunction or ED is often an early warning sign of which condition? Is it A, heart disease, B, depression, C, prostate cancer, or D, high testosterone? Early warning sign is
Early, yes.
yes.
That's the key thing here. This is a test taking strategy. Like,
All right, and so I see responses from Anthea and from Anna K. Anyone else going to respond? We're going around the alphabet. I see C's and B's and D's.
these interesting.
All right, we're going to reveal the answer in 3, 2, and I think Marjorie has it.
Boom, it is a heart disease, right? Good
Great
job.
job.
Great job. Because it is a cardiovascular health issue and it can be an early sign of circulatory disease, right? High blood pressure, even diabetes, but it's really linked to cardiovascular health, like heart failure and heart disease.
Great job, team. I'm so happy that you're engaging and I hope you're learning a lot. All right, so we're halfway done with our test. Question number 12, what lifestyle change can help improve erectile dysfunction? Is it A, increase in alcohol intake, B, regular physical exercise, C, smoking more cigarettes, or D, reducing water intake? And because we have talked about this multiple times, I'm just going straight to the answer. And the answer is, of course, B,
Physical exercise. Perfect. Yeah, because they help with circulation. If we can help the heart, we can help the disease, right?
Right.
If
That's
you make
right.
the heart stronger, remember, instead of watching TV, you can go get exercise, right?
So when they say Netflix and chill, they're actually decreasing their libido.
They are. And you're dropping your testosterone, guys. Whoops.
So get up, get outside, go hunting, go fishing, go for a jog, and that will improve your hormones and your sex drive. All right, so question 13. If you weren't here before, STI is sexually transmitted infection versus STD, sexually transmitted disease. So 13, which of the following STI is vaccine preventable? And I know you touched on it.
I sure did.
HIV, B, gonorrhea, C, HPV, or D, syphilis? Which is vaccine preventable? Oh, I see correct responses coming through. All right, we're revealing the response, the correct answer in 3, 2, and
HPV. There we go, right? It's the vaccine women get when they are in their teens, and it helps prevent cervical disorders caused by HPV. So yeah, it can cause warts and cancer. So it's one of the only few ones that can be vaccine preventable. So yeah.
Something you said that I didn't even think about was, sometimes men don't want to get vaccinated because they're like, hey, we're carriers, we don't have the symptoms. But because of different sexual preferences, you mentioned it could still impact their oral health.
Men can get oral and penile cancer, absolutely. And not only that, some parents don't want to give the HPV vaccine because they're just like, well, my kids aren't sexually active, and they get a cringe factor from it. But I'm here to say that, at some point they're going to be active. So,
weigh out the risk and just do your research.
100%.
All right, so question 14. What is the most effective way to prevent STI transmission during sexual activity? Is it A, urinating immediately after having unprotected sex, B, having multiple sex partners, C, avoiding physical activity, or D, using condoms consistently and correctly? We can say so much about that last one.
I know. I actually, yes, absolutely.
And so, Shane, what I'm doing is anything that I think would be a great video topic, I'm over here writing it down. So sorry.
As you should. No, this is good. I like it.
You're stuck with us over here.
That's fine. It's a good place to be.
All right. So, ladies and gentlemen, the correct response is, Shane, take it away.
It is using condoms consistently and correctly, right? Because they significantly reduce, almost eliminate STI transmission when you use them correctly and when you use them. So they don't work if you don't use them. So.
All right. Question 15, which STI can lead to long-term complications such as infertility if left untreated? Is it A, herpes, B, chlamydia, C, HIV, or D, HPV?
I spent the whole slide on this, so they're going to get it right, right?
They're going to get it right.
They're going to get
unless
it.
unless it was lunchtime and they were like eating their lunch instead of watching
Oh, good
video.
point. Yeah, that's fair. All right.
So let's see. Ooh, I don't see any responses yet. Is
Come
it
on.
herpes,
Think about it.
chlamydia, HIV, or
Or HPV.
HPV? We'll reveal the correct response in three, two, and Shane, you create a whole slide about it, and I'll
I
reveal
sure did.
it.
Chlamydia. Good job. I see the answers down there at the bottom. And it's not just for men, but it can cause PID in women. This is not a condition that you want to have. This is a life-threatening, right? PID can kill you, and at worst, it can cause infertility. So careful.
Very good point. I'm so happy everyone got that one correct.
Absolutely.
16, which STI often has no symptoms but can still be transmitted? And I guess the symptoms would be in men.
Correct.
So
In
is
men.
in A, HIV, B, chlamydia, C, gonorrhea, or D, syphilis? And Geruto, when I first was creating this practice test, I was thinking it was HIV too, but HIV does have some symptoms. They
They
get
do.
flu-like symptoms.
Blue
So
like. There you go.
yeah, so I got this wrong
Muscle
initially too.
skills. Mm-hmm.
So everybody, it's not A because
Oh.
yeah, but it's okay. I see a lot of A's. The correct response is again
Chlamydia. That's why I spent the whole slide on it, right? Everyone takes it so like nonchalantly, but it can be a problem, especially in men who don't show any symptoms whatsoever. And especially if you're not getting tested, you can pass it along to your partners.
Yep, and having multiple sex partners. So even though the man is asymptomatic, the women that he's having sex with, they're going to start having symptoms. And so, what are some of the symptoms of chlamydia in a woman?
And the woman herself, oftentimes she can have like no issues there as well, but it's infertility, and it can be pelvic pain as well. So it feels like a cramp, and they can sometimes have a discharge, but not always.
Okay, all right.
Not
So
always.
get those annual checkups, everybody, and use condoms. All right, question 17. Which of the following is a symptom of an STI in a man? Is it hair loss, hair bumps, discharge from the penis, or improved energy? And I'm just going to go straight to the answer because there is no reason for anyone to get this wrong, because if your patient, most of our audiences, they're caregivers, or so you're going to be taking care of somebody who is maybe older, could be younger. And when you're giving that bath, if you smell something that doesn't smell right, or if you see something that you shouldn't be seeing, such as discharge from the penis, that person could possibly have an STI. So gonorrhea.
I love how you helped them with their assessment techniques, right?
That's my job.
Yeah, I saw that. Like I caught on. Like use your senses, and if it's not right, it's probably not right, right? So the smell, the look, the discharge, anything like that, use your senses, friends. Good job.
What a lot of people, what they don't consider is that because of the use of Viagra and these other sexual enhancements, they're not expecting for a 70-year-old man to have a penile discharge. So STIs in the elderly is still a thing. And as a caregiver, you want to be aware that, even though he's all nice and sweet while you're taking care of him, when he leaves the hospital, he has a life that he's not telling anyone about. And so
in Florida, that's one of the rising populations that are getting more STDs is that older population, right? Because they're like, I can't get pregnant. I'm like, well, true, but you can still get other things, right? So that population is growing fast.
And something that I probably shouldn't be talking about with my audience is people not properly cleaning basement toys. And so that would be another reason why STIs are spreading. All right, so question 18. What is the primary benefit of regular STI screening? Is it A, increased sexual desire, B, helps determine if a condom is needed, C, increased testosterone levels, or D, early detection and treatment of infections? What is the benefit of regular STI screening? And we're going to reveal that answer in 3, 2, and I see so many great answers.
I saw the D. Great job. I know I got on my soapbox here a little bit, so I appreciate you guys listening, but it's early detection and treatment of the infection is important to screen and catch things early. And it's not just for STIs, it's for anything healthcare related. So that's why I was on my soapbox. Thank you.
All right, question 19. Which color of penile drainage is most commonly associated with a sexually transmitted disease or infection, STI? Is it A, clear, B, yellow or green, C, red, or D, brown? And I want you all to think back to the video I made about the different colors of urine and fecal matter. And so based on the color, it's kind of the same with the bodily fluids, where if it's red, it means one thing. If it's clear, it means something else. So let's see what answers you all have. In 3, 2, and
Boom, yellow or green. Great job. I saw that. It's associated with bacterial, right? And it's more of a, we call it purulent drainage or pus-like, right? And that tells us that we need to do a prompt evaluation and see what that is. And oftentimes it's with antibiotics, right? So great job.
Great job. Question 20. Which of the following can help prevent transmission of HIV? A, not using condoms. B, sharing needles. C, PrEP or pre-exposure prophylaxis. Or D, avoiding STI testing. And this may be something that we did not talk about. However, I saw a bus and it was advertising. Revealing the answer in 3, 2, and Shane, take it away.
PrEP, pre-exposure prophylaxis. This is one of those questions is like process of elimination, right? Those other ones are absolutely incorrect, but PrEP is fantastic, especially if you're a high risk person that is in the LGBTQ cohort. So this is huge, 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 huge.
Okay. And now is PrEP, again, because I don't know how it's taken. Is it oral? Is it injectable?
Oral and injectable. It is a combination antiviral medication that almost makes you 99% not getting HIV. So
or is it that they don't get it, or that their viral load is undetectable?
So it can be used for both. So you can take it before you're exposed, which is called pre-exposure prophylaxis or PrEP, and then you can also take the antivirals if you have active HIV. So it's both those virals.
Thank you for explaining. Question 21. A patient taking, I'm going to say Viagra, complains of a painful prolonged erection lasting over 4 hours. What is the medical term for this condition and what should be done? Is it A, priapism? I did not pronounce that correctly, priapism. Go ahead and say it for me, Shane.
Priapism. You were very close. You were so close.
Thank you. So is it A, priapisms? I still can't pronounce that. It's my southern dialect. Seeking medical attention. B, Peyronie's disease. Apply ice packs. Ouch. C, balanitite. How do I say that? I don't know. Balanitite. Whatever Shane said. Look, my background
I've been doing this for too long. Sorry.
My background is not in men's health, so I have not heard of some of these medications. Take over-the-counter pain relievers, or I'm going to say phimosis or phimosis.
Yes.
Avoid further sexual activity. So I'm sorry for butchering those terms. This should have been Shane's slide.
It's okay. It's okay.
All right, so team, we're going to reveal the correct response in 3, 2, and looks like we have a lot of A.
Yes, priapism. Yes, it's a prolonged erection. I know I actually talked about that, right?
You did.
And it lasts more than 4 hours. It's an emergency because it can cause damage. So I can understand where you guys would see D, but that's for our men that are uncircumcised and that foreskin doesn't actually retract. That's phimosis, guys. So I can see.
All right, so 22, how does stress affect testosterone levels? A, it increases testosterone levels. B, only affects testosterone during exercise. C, has no effect on testosterone. Or D, reduces testosterone levels. Stress. Let's talk about, today we have the election. People are having financial concerns. a lot of unemployment. So, how is that going to impact someone's sexual desires, their sexual health? And so, if you chose D.
Reduces, yes. Yeah. I can't tell you how stress is a silent killer. Everyone talks about how high blood pressure is, but oh man, stress and cortisol is a killer.
Okay. Let's go to and I love the time we spent together. And so you all, if you haven't already liked this video, give it a thumbs up, help us with the algorithm. And then at the very end of this video, head over to Shane's YouTube channel and give him today at least 5 subscribers. I mean, if we can get 10 before the end of the week, hold up, high five.
That'd be great. That'd be great.
All right, so question 23. A 60-year-old male comes to the ER with chest pain after taking Viagra for erectile dysfunction. He admits to feeling embarrassed about his condition in front of his family. What is the most appropriate nursing action? A, ask the family to remain in the room for support. B, continue questioning the patient in front of the family. C, encourage the patient to avoid discussing his ED with family members. Or D, acknowledge his concerns and offer to speak privately.
I love this question, by the way.
Oh, they were really fast. Look, they're already putting answers in. This is a real life question for me. It's a real life scenario. I'm sure it is for you also. So by revealing the answer, you all are so correct. Shane, take it away.
Yes, acknowledge his concerns and offer to speak privately. It's so important, right? You need to be able to give them dignity and respect and to talk about their concerns. That's our job, is to help them with their concerns, right? This is all part of what I teach my students called motivational interviewing, right? It's so important that we talk to them to get the right answers out. You guys are like little detectives, and asking these questions and doing these concerns are going to build that rapport, and they're going to love you guys. So this is a great question. I really like this question.
I remember 2 scenarios. One, the family members in the room, the husband was taking Viagra, but he wasn't taking it to have sex with his wife. He was taking it because he was cheating on his wife. And as I was starting to hang the nitroglycerin drip, he was like, I really need to talk to you, because I had already asked those questions, but I asked in front of his wife, who at the time would not leave the room.
Life lesson you learned.
Yes, life lesson. And so I was like, hey, can you please step away for a few moments? I just want to ask him some questions. And that's when he admitted to his Viagra use. And so, of course, we could not give him IV nitroglycerin. So that changed his whole plan of care. And the second time was there was a young gentleman who the nurse started IV on him downstairs, asked about his medical history. And because she asked about the medical history in front of his other family members, he did not tell her that he was HIV positive.
Ooh, wow.
It wasn't until he was on the floor with me that he was like, hey, I just want to let you know that I couldn't tell her downstairs because she did not ask me in private, and I am HIV positive. So
wow, that's insane. But I do have a fun fact. What was sildenafil, also known as Viagra, originally created for? What was it originally created for?
I think I know the answer, but I'm not the one to tell it.
It's okay. What was it originally created for?
All right, any guessers? We'll give you 10 seconds.
Come on, it's good.
Dr. Google is your friend.
I'm okay with that. Use your resources. I always tell my students, use your resources.
All right. So what was, you said it was Viagra?
Heart failure, yes. Sildenafil was originally created for heart failure, but then again, we learned that it has some interesting side effects.
And I was thinking pulmonary hypertension. So, but I think
yes, pulmonary hypertension too, though, as well, which is a complication of heart failure as well. Yes, both.
Love it. All right, so everybody, question 24. What interventions is most? You didn't introduce us to the first family member?
I'm sorry, that's my son.
All right, so which of the following interventions is most appropriate when a patient presents with chest pain after taking Viagra? Is it A, administer nitroglycerin for chest pain relief immediately? B, perform an EKG and assess vitals but avoid nitroglycerin? Is it C, reassure the patient that chest pain is a normal side effect of Viagra? Or D, give aspirin and nitroglycerin without without a thorough medical history. Oh my God, think about some of the things that Shane and I have just discussed. When you're asking those questions, what medication is contraindicated if a person has taken Viagra and they have chest pain?
Oh, wow. Yeah, this is a good question. I actually like this question.
Okay, okay, okay. I see D's, B's, A's. We'll wait for two more responses and then we'll
Okay.
reveal the correct response.
Oh, I see the right answer. I see it. I see it.
Yes, so a lot of right answers. Take it away, Shane.
All right. It is do your workup with the EKG, do your vitals, but avoid nitroglycerin because remember, it can cause that profound hypotension, guys. They can't take it within 24 to 48 hours because it can cause that drop, right? But still do the workup, but just don't use that nitroglycerin, guys. Okay. Good
Okay.
work.
And in question 25, what is the most appropriate action when a patient reports penile drainage that is yellowish green and feels uncomfortable discussing it with his partner? Is it A, encourage the patient to seek medical advice without telling the partner? B, suggest that the patient avoids further sexual activity until the drainage clears? C, explain that such drainage may indicate a sexually transmitted infection and advise discussing with his partner and a healthcare provider? Or D, reassure the patient that the discharge is likely a side effect of Viagra?
Another great question. I like this one.
Thank you so much. We are
You are
an
welcome.
awesome team.
I agree. This is a
All
great
right.
question.
And then don't forget our viewers. So, and I know that Anna Kay or someone said they came in late. Hey, we're
That's
happy to
okay.
have you here regardless of what time you came in. And so looks like Miriam says, I think that was the last one. So I think Marjorie says C. Any other answers? Let's see. Revealing the correct response in 3, 2, and
Dun, 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 dun. Great job. It is C. It can tell us that it's an STI. Remember that yellow or green is commonly seen with gonorrhea or chlamydia, right? And so it's important to let them know that, educate them, evaluate them properly, and also communicate with the partner. That's so important. Is the communication. So
yes, and we just don't want them getting treatment without notifying the partner because they're going to clear up their infection, but their partner could be active with others. And so if you're a CNA, of course, this is something you're going to be reporting to the nurse. If you're a nurse, you're going to be reporting it to the doctor. So you're going to follow the chain of command. You're going to know that it's, not normal. And as a CNA, if you're not comfortable, saying such things, remember, you are not alone. You're going to be notifying the nurse. So you see something, you say something, and then the nurse will go in and have that uncomfortable conversation. Do you want to add anything to that, Shane?
Oh, that is, you just knocked it out the park. That is the truth. Is like, if you don't feel like talking about it, that's fine. Delegate it to either your nurse or the NP or whoever's there and just take care of the patient. That's really what it's all about. And even in certain states, there is partner therapy that certain states can do is that I can prescribe that medication for the patient and their partner. So
I love that. I did not know that. So we have learned so much. So Shane, thank you again for being our guest and for your dedication to transforming not just healthcare and men's health, but also entrepreneurship and just getting those nurses to think outside the box. So that's why I love you so much. And to our viewers, if you would please give a thumbs up. If you enjoyed it, put a 1 in the chat. I know this is something different and I know you want your CNA and your exam prep review questions. I will do that on Thursday. I have another video on Thursday and then Phyllis will be on tonight and she has a exam prep video also. So please let us know if you have any final words. And if not, we're going to let Shane get back to his practice. So Shane, we appreciate you. Oh, ShaneGrindle.com. And don't forget, he needs at least 9, because I was 1. He needs 9 subscribers to his YouTube channel, everybody. So there's no further questions. You all take care and goodbye.
Goodbye, guys. Thanks for having me.